name is Bud O'Neill. I'm a pulmonary and critical care specialist. I work for LSU Health Sciences Center in Baton Rouge.
Explain to us a little bit, what are your responsibilities as a physician in pulmonary medicine?
Sure. So my specialty, I actually have two specialties. So most pulmonologists are actually pulmonary physicians. So we treat patients with pulmonary disease. And then many of us also work in the ICU. So we do critical care medicine, which is taking care of patients in the intensive care unit. But as far as pulmonary disease, the practice is largely both inpatient and outpatient. So we see patients in the hospital who have pulmonary disease, including lung cancer, COPD, interstitial lung disease, and some unusual diseases of the lungs. And then we often follow those patients in the outpatient setting. With regards to certain diseases like lung cancer, most of our responsibility is in the diagnosis and staging of the lung cancer, and then we refer those patients to surgeons and oncologists for treatment.
So, from what do you see patients suffer the most through the stages of their disease and through the treatment of it? Would it be like giving up a bad habit that has caused them to go down this path, or?
Sure, I think that there are a couple of things that we see with cancer treatment. Number one, there's the physical aspect of the actual treatment. The operation, if it's surgical, the operation can be difficult. Lung cancer is one that, if you're lucky, the best thing that could happen to you, if you're lucky, is that you have, a segment of your lung cut out, which is, that's if you're fortunate. Now, if you're not fortunate, then, you have a potentially unresectable tumor, and those patients, rarely survive beyond a couple of years at the most. And so I think that there's the physical aspect of actually tolerating the treatment, be it an operation or chemotherapy or radiation. I think there's a lot to that. It can make you sick, it can make you feel lousy, and it's a life that you have that's going to be significantly shortened, and you don't want to spend that short part of your life sick, but it often does. They often do. I think that there's the thought of regret. Patients who get lung cancer, I think it's pretty widely known. I would guess that you all know that cigarette smoking causes lung cancer. I think it's pretty widely known now, but people continue to do it. You probably know people who smoke, and young people who pick up cigarettes and smoke, every day. I think that once a patient's diagnosed with lung cancer, there's a tremendous amount of regret that's difficult to deal with. I think that they look at their family, they look at children and grandchildren, and wish that they had never done it. And I think that psychologically is very difficult. Knowing that they're going to be leaving family behind is very difficult. And then financially, it's expensive. It's expensive to treat lung cancer. It's expensive. It costs a ton of money to be sick. People lose their jobs. They can't support themselves or their families like they could before. And unfortunately, it takes people's lives who are often in the prime of their lives, 50 years old, 45, 50, 60 years old, who are still working, still making a good living.
What would you say the average public can do to both spread awareness of the ill effects of cancers and ways to prevent cancer like that, and also to further research about the disease? Yeah,
so I think that number one, there are many things that we can do to prevent many of the common cancers that we see. So if you look overall at cancers, let's take lung cancer for example. Lung cancer is probably the second most commonly occurring cancer in men and women, second or third in women, and second most common in men after prostate cancer in men and breast cancer in women. It is the most common cause of death due to cancer overall in the general population. The most common cause of death due to cancer in men, and probably the second most common cause of death due to cancer in women. But overall in the whole population, it is the cancer that kills more people than any. In fact, when you look at those death rates, cancer kills more people overall than the top three combined, than the next three combined, which would be breast, prostate, and colon cancer. And so I think a lot of people don't understand the impact of lung cancer. A lot of people also don't understand that around 90% of lung cancers occur in smokers. So we could take the disease that the cancer that kills more people than any other and reduce its impact by 90% if people would just not smoke. And I think that there are a number of behaviors like that, and it's not just lung cancer that we can look at.